Hello. Today we're talking about a topic that, unfortunately, many people are familiar with: gastritis and stomach ulcers. This is more than just discomfort in your belly or pain after eating. It's about quality of life, health risks, and the path to recovery, if you act in time. So let's break it down in plain language, without complicated terms. Gastritis is inflammation of the stomach lining. It can be acute, sudden, for example, after a questionable meal or severe stress, or chronic, when the inflammation lasts for years and gradually damages the stomach walls. At a certain point, this can develop into something more serious: an ulcer. An ulcer is already a wound in the stomach lining. Deeper, more painful, more dangerous. If gastritis is irritation, then an ulcer is actual tissue damage, with a risk of bleeding or even stomach wall perforation. That's why it needs special attention. Why does it happen? The stomach constantly produces hydrochloric acid, necessary for digestion. To avoid damaging itself, the stomach lining produces a protective mucus layer. When this protection is weakened, the acid begins to erode the tissue. Inflammation, gastritis, occurs, and with prolonged exposure, an ulcer forms. Main causes include Helicobacter pylori, a bacterium that causes inflammation and damages the protective lining. Excessive use of painkillers, especially NSAIDs, aspirin, ibuprofen. Alcohol, smoking, coffee on an empty stomach, all irritants. Stress, irregular meals, fast food. Sometimes, autoimmune factors or genetics. Important: many people live for years with gastritis without knowing it. But if left untreated, inflammation worsens, and an ulcer appears. And that's no longer just pain, it's a risk of bleeding, anemia, or even peritonitis. So don't wait until it gets worse. If you regularly experience discomfort in your stomach, heartburn, nausea, pain after meals or when hungry, it's time to pay attention. It's not always something serious, but definitely not something to ignore. In the next episode, we'll look at how gastritis and ulcers develop, what exactly happens in your body. Your stomach works like a chemical lab every day. It releases acid and enzymes to break down food. To prevent these aggressive substances from damaging the stomach itself, nature provided a protective layer, the mucosal lining and mucus. Balance is everything, acid versus defense. But when this balance is broken, problems begin. Most often, it's due to Helicobacter pylori bacteria, poor diet, harmful habits, or long-term painkiller use. Over time, the protective barrier weakens, and acid becomes more destructive. What does Helicobacter pylori do? It survives in acidic stomach conditions. Once inside, it burrows through the mucus and attaches to the stomach wall. It triggers inflammation and disrupts the stomach's ability to heal. It also increases acid production, making the damage worse. What about NSAIDs? Drugs like ibuprofen, aspirin, diclofenac block prostaglandins, compounds that protect the stomach lining. Less mucus is produced, blood flow to the lining drops. And the stomach becomes vulnerable. Stress plays a role too. Stress hormones raise acid levels, reduce blood flow, cause spasms. This isn't a direct cause of ulcers, but a strong risk factor, especially with bad habits like skipping meals or drinking coffee instead of breakfast. Alcohol and smoking. Alcohol weakens the mucus layer and increases permeability. Smoking reduces blood supply and slows healing. Together, a toxic combination. End result: the mucosal barrier weakens, acid penetrates, inflammation begins. If left unchecked, tissue damage deepens, forming an ulcer. A serious, sharply defined wound, sometimes bleeding, sometimes perforating. The good news: stomach lining can regenerate quickly, if you remove the harmful triggers and start treatment. Next episode: symptoms, how to spot trouble early. Symptoms of gastritis and ulcers can be obvious or subtle, sometimes you don't feel them until it's serious. But the body always sends signals. The question is, do we listen? Common symptoms. Pain in the upper abdomen, epigastric area. Heartburn, burning behind the chest or in the throat. Sour or rotten burping. Heaviness after eating. Reduced appetite. Nausea or vomiting. Bad taste in the mouth. Bloating or gas. Gastritis often causes dull pain after eating, heaviness. Ulcers tend to hurt when hungry, at night, or 2 to 3 hours after eating. Pain might ease after a snack, known as hunger pain. Complications may cause vomiting blood, like coffee grounds. Black, tarry stool, a sign of bleeding. Sharp, sudden pain and hard belly, possible perforation. But not all cases show symptoms. Up to 20% of gastritis cases are silent, especially in people used to tolerating discomfort or taking painkillers often. That's why checkups and listening to your body matter. Symptoms vary depending on ulcer location or gastritis type. Duodenal ulcers equals pain on an empty stomach. Antral gastritis equals intense heartburn. If you see these signs, don't wait. Next up, diagnosis, fast, safe, and accurate ways to know what's really going on. To treat it right, you need a clear diagnosis. Don't guess, look inside. Step 1, visit your doctor. They'll ask about your symptoms, timing, triggers, habits. Based on this and physical exam, they'll suggest further tests. The gold standard, gastroscopy. A thin camera tube goes through your mouth into your stomach. In just minutes, the doctor can see inflammation, erosions, ulcers, bleeding, chronic changes. Gastroscopy is quick, 5 to 10 minutes, often done with anesthesia or sedation. If H. pylori is suspected, the doctor may take a biopsy, a tiny sample for lab testing. Or use a rapid test during the procedure. Other H. pylori tests. Breath test, detects byproducts of the bacteria. Stool antigen test. Blood test for antibodies, less accurate. Other helpful tests. Complete blood count, for anemia/inflammation. Stool test for hidden blood. Abdominal ultrasound, to exclude other causes. X-ray with contrast or CT, for complicated cases. Diagnosis is your map to recovery. In the next episode, how we treat gastritis and ulcers effectively. When diagnosis is confirmed, don't just mask symptoms, fix the root problem. Kill the bacteria, H. pylori. Take 2 antibiotics plus a proton pump inhibitor, PPI, for 7 to 14 days. Reduce acid. PPIs, omeprazole, pantoprazole, esomeprazole, reduce acid so the lining can heal. Treatment can last 4 to 8 weeks or more. Protect the lining. Bismuth compounds, sucralfate, and alginates create a barrier, help healing, and block bile acids. Follow a diet. Warm, gentle foods during acute phase, porridges, soups, steamed meat, bananas. Eat small meals 4 to 5 times a day. Quit harmful habits. No smoking, no alcohol. No coffee on an empty stomach. These delay healing. Avoid risky meds. If you must take NSAIDs, always add a protective agent. Better yet, find alternatives. Follow up. After 1 to 2 months, repeat gastroscopy. After H. pylori treatment, repeat breath or stool test. Stick to the plan, and you'll heal. But how to stay well long-term? That's next. Prevention is simple, but powerful. Know your triggers, and stay ahead. Eat regularly. No starvation or binging. Eat 4 to 5 times a day, same time daily. Choose the right foods. Less fried, smoked, pickled. More boiled, baked, stewed. Avoid soda and fast food. Ditch harmful habits. Quit smoking, avoid alcohol. No coffee on an empty stomach. Use meds wisely. Don't abuse NSAIDs. If needed, take with protection. Always consult a doctor. Manage stress. Stress raises acid levels. Restore balance with walks, hobbies, exercise, sleep. Stay clean. H. pylori spreads via saliva, dishes, unwashed hands. Wash hands, don't drink raw water. Get checkups. Gastroscopy every 1 to 2 years if you've had symptoms. Monitor your health. Simple steps, big impact. But what if you already have gastritis or an ulcer? Let's talk daily life. Recovery isn't the end, it's the start of a new approach to living. Nutrition. Eat small portions 4 to 5 times a day. Avoid very hot or cold foods. Skip spicy, fried, fatty, sour meals. Eat home-cooked, steamed, or boiled food. Helpful foods. Oatmeal, semolina. Pureed soups. Bananas, jelly, rosehip tea. Boiled chicken or fish. Soft-boiled eggs or steamed omelets. Low-fat dairy. Avoid alcohol, coffee on empty stomach, smoked snacks, chips, spices, acidic juices, tomato sauces, vinegar. Daily habits. Keep a routine. Rest well. Avoid overwork. Handle stress, go outside, read, breathe. Monitor your condition. Repeat gastroscopy after 6 to 12 months, if ulcer. Check for H. pylori again, if treated before. Don't ignore returning symptoms. This diagnosis isn't a life sentence. Just a signal, care for your stomach, and it'll care for you. Live fully, live wisely. You've got this.